A guide to taping to restrict the range of movement of your wrist in all directions. Following your wrist injury, you have been recommended to use the following taping technique to support your wrist based upon your clinical assessment. The aim of taping is to restrict the range of movement of the wrist in order to allow any soft tissue or ligament injury time to heal. This is part of a conservative management plan that may also include night splints, advice to avoid excessive movements that bring on the wrist pain, or advice to avoid prolonged positions of the wrist, and exercise. Your therapist will have described to you how to apply kinesiology tape to your affected hand and forearm. Tape should be used throughout the day, including when driving. To perform this taping technique, you will need 6 different pieces of kinesiology tape. Your therapist may have sent you out a first set. Firstly, you will need to cut one piece 13 centimetres in length. You will then need to cut this piece in half, giving you 2 pieces, piece A and piece B. You will then need to round the edges off of each of these pieces. These will be used for around the thumb. Secondly, you will need to cut a piece that starts from the underneath the joint in the thumb and goes a third of the way up your forearm. This piece will differ in size from person to person, so there is no guide on squares. You will also need to round the edges of this piece. This is piece C. Piece D will be measured from the base of the knuckle underneath your little finger down a third of the way of your forearm. Again, there is no guide to this as this will differ from person to person. Please round the edges. This is piece D. Piece E will be another piece cut 16 centimetres long, and again the edges will be rounded. And piece F, again, will be 14 squares long and the edges to be rounded. These 2 pieces will be used around the wrist. Before starting the application of tape, please ensure your hand and forearm are clean and dry and free of any moisturisers or creams, as this may hinder the tape from sticking. When you start, rub the tape with the backing on in your hands to help activate the tape. Do this for each piece. For each piece, we will apply it directly onto the skin with no stretch for the first 2 squares. We will then apply a 50% stretch of the tape as it goes round the area. To start with, take tape A. Peel back the back of the tape until it is 2 squares down. We are then going to open the hand and the thumb so that we are creating a nice space. We are then going to apply the tape around the space at the back of the thumb directly onto the skin with no stretch. We are then going to stretch the tape to 50% of its maximum stretch and take the tape around the base of the thumb onto the front of the arm like so. We will then smooth the tape down. This provides the first bit of support to the thumb. We are then going to take tape B. Again, take the back off the tape for 2 squares, peel this back and apply the tape in the opposite direction to the one that you have just applied. So it will come around the back of the thumb. Again, 50% worth of stretch on, and this time we will bring it around the front to meet the other, and again down the side. Making sure everything is smoothed and stuck down. For tape C, rest your arm straight on the table so that it is supported. This is your longest tape, and it is going to be placed from the base of the joint in the middle of your thumb down your forearm in a straight line. This is why supporting the wrist on the table helps. Again, peel the back off the tape for the 2 centimeters. Rest your thumb into a neutral position. We don't want thumb all the way up or thumb all the way down. So just in a rested and relaxed position, apply the tape underneath the joint of the thumb, again directly onto the skin, and then apply a little bit of a stretch on the elasticated tape down, pressing it down as we go, and down again. Making sure that everything is staying nice and straight as we do that. And then smoothing down. Okay, again, just giving all of that tape a little bit of a rub just to activate that glue so that things stick nicely. What you will find there is that the wrist is already feeling a little bit restricted. That is tape C. So far, after applying tape A, tape B, and tape C, the thumb side of your wrist should be supported with tape. The next tape is tape D. This is the tape that's going to go from underneath the knuckle by your little finger down your forearm on the outside. Again, peel the backing of the tape off 2 squares width and apply underneath the base of the knuckle. Again, you want to apply this in a nice straight line with the wrist in a neutral position. You don't want the wrist to be bent either way or up or down, as the aim of the tape is to reduce those movements. So the wrist should remain flat. Now that we've shown you where the tape would go, you would apply it with the hand flat in this position. And again, smooth that tape down. The next is tape E. The middle of this tape, when applied, should be on the outside of the wrist. Again, peel back 2 square widths and the start of this tape should sit underneath the thumb. Now for this tape, we want to keep your wrist creases clear. So we apply the tape like so. Again, putting it directly onto the wrist and then giving it a little bit of a pull. Remembering when doing this to keep the hand still in that neutral position. You don't want the wrist to be bent in any direction, as this will affect the tape. Making sure, again, that we are giving that tape that stretch. Again, rubbing down the edges of the tape, like so. The final tape is tape F. With this tape, we are going to start it in the middle of the top of your wrist. This tape should overlap by a half of the tape E. Okay. Again, peel back 2 squares of tape F and apply to the middle of the wrist and stick it down. Like we've done with the previous tapes, a stretch on the tape. Again, wrist is staying nice and straight. I'm going to take that tape all the way around, still stretching it so that we're getting a lot of support. And then as we go to stick this down, you take the stretch off. Smooth out all of the edges, and that's the reason that we round the edges, is so that it's less likely to pull up during day-to-day activity. That is your tape applied. You will see and feel that this tape now helps to reduce the movement at the wrist. If you try to lift the wrist up, you will find that the range of movement at the wrist is reduced when compared to the opposite side. The same with outwards and inwards. As we mentioned at the start of the video, the reason that we do this to limit the movement is in order to protect the soft tissues and ligaments that sit around the small bones of the hand that may have been injured. It is useful to keep the backing pieces of the tape and perhaps label them with the letters as shown here. These then can be used as stencils for the next time that you need to redo your tape so that you don't have to measure it each time. So to summarise, you should have two pieces of tape, one going this way and the other going this way, which are A and B around the thumb. You should then have piece C, which starts at the bottom of the knuckle of the thumb and goes down the side of the forearm in a straight line. You should then have piece D, which starts at the base of the knuckle of the little finger and goes straight down the forearm. And then you should have piece E, which goes around the wrist, starting at the base of the thumb. And you should then have piece F, which is a little bit further down and again helps to limit the movement. This has been a video to show you the technique to help tape your wrist to limit the range of movement at the wrist joint. If you notice any redness or rashes of the skin following the use of tape, please discontinue this immediately. If you have any further questions, problems or concerns, please contact your therapist.